Hi, I'm attorney Paul Samakow. I've been practicing personal injury law in the Washington, D.C. area, Northern Virginia, suburban Maryland, for about 40 years. I'm fortunate that I get a lot of clients, and they are always concerned, not always, but many times they're concerned about how much money I'm going to get. And one of the key things that they're concerned about is what their medical records are going to say to prove up their case. It's a very interesting process to understand, and I hope that I'm going to be able to give you some information here to explain that. Okay, so we're going to talk about how adjusters use your medical records to try to reduce this settlement or the amount of money they give you, the compensation that they're going to offer for you because you've been injured. Insurers consider your medical bills the primary claim valuation factor. You understand what I'm saying? This is the number one thing that they use to decide how much money to offer you to resolve your case, your medical records. So the adjuster is going to very carefully scrutinize, review 16 ways from Sunday, your medical records, looking for ways to reduce your claim's value. In particular, adjusters are going to look for 7 what I'm going to call red flags in your medical records. Okay, so let's hit it. Number 1, are your medical records proportional to your claimed injuries? Okay, what do I mean by that? Insurance adjusters look for consistency between the injuries claimed and the medical bills and records showing what the treatment and the charges were. They develop, I don't know, we'll call it a sixth sense as to when the medical bills are out of alignment with the nature and severity of the injury. Okay, I asked, what do I mean by that? Let me explain. Muscle injury claims, your neck, your back, whiplash kind of cases, or low back pain, right? These are prime candidates for what the adjusters call buildup. This is a term that is used to suggest that you are fraudulently even increasing the medical bills incurred to artificially inflate the settlement value. Physical therapy treatments that continue on and on and on with no reduction in the number of visits per week and no appreciable improvement are always suspect. So again, I'm not your doctor, I don't know your body, but routinely, if you are, of average height, weight, build, and in average physical or health condition, and you have a neck sprain or a back sprain, we might normally and reasonably expect that in 2 or 3 or 4 months of therapy, physical therapy, chiropractic treatment and care, that you'd get mostly better, if not completely better. So by the time, and if that does describe you, then by the time you get to 7 months or 8 months, that's going to raise eyebrows over at the insurance adjuster's office. Why is this taking so long? The notes are saying that you're still in pain. You're telling them every day you go in that you're still a 7 or an 8 out of 10, and 10 is the worst. So that's the first thing, the proportionality of your claimed injuries to the records. The second thing out of this list here is the 7 red flags, if you will. Where were you treated? Now, in addition to the amount of your medical bills, the source of those bills is going to be important to the adjuster. In the eyes of the insurance, eyes of the adjuster, a 2-week hospital stay and 3 months of physical therapy are much stronger evidence of an injury than a few $1,000s worth of diagnostic tests like MRIs and X-rays and what have you, and adjustments by a chiropractor. So you need to be concerned about the quality of care you're getting. And that's not to say chiropractors are not good medical care providers, but just be true to yourself. And when you're done treating, stop the treating. When you're feeling better, stop the treating. The third red flag: do your medical records suggest a lack of causation? Do they connect the injury to the accident? Do your records include a notation about prior claims or injuries? Were you already treating with a neck injury and now this made it worse? There has to be documentation. Is there any mention of a pre-existing condition or an injury to the same body part? Are there references to intoxication, alcohol, or drugs? Does anything in your medical records deviate from the official account of the accident that's been represented to the adjuster? All of these good questions that could potentially reduce your settlement if the answers don't favor you. The fourth red flag: is there a relationship? Is there a correlation between the medical records and the treatment that is received? Now, adjusters become suspicious if the medical bills that are submitted lack corresponding medical reports. Those reports validate the diagnosis made, the treatment given, and future prognosis. So you've got to have those things line up. If a medical report doesn't accompany each set of bills, the adjuster is certainly going to discount or even completely disregard the charges. In a medical malpractice case, as an example, it's often said, if it's not in the chart, it didn't happen. Some adjusters, by the way, take the same approach to evaluating medical expenses. If there's not a medical report to go along with the bill, it's probably not going to be considered. All right, the fifth thing that I want to talk about, the fifth red flag about medical records. What is the quality of the medical information provided? We see sometimes poor records, what we here in my office call fill-in-the-blank medical records. These are viewed with skepticism by insurance claims representatives and adjusters. Narrative reports, however, that explain, and you could read and understand from well-respected doctors explaining, again, the nature of your injuries in descriptive detail are what you're looking for. Hospital records with detailed nurses' notes are also excellent sources of information on your injuries. All right, let's hit the sixth red flag. What did you tell the first doctor you saw after the incident? Expect the adjuster to scrutinize the medical records of the first caregiver, focusing on the history given. If that history says nothing about an accident or attributes the injury to a pre-existing condition, expect the adjuster to resist. We have this kind of thing, 10, 15, 20% of the time, where your neck is killing you and you tell the doctor at the hospital, oh, my neck, I can't move it. And then you go home and all of a sudden that you realize that your knee is also very badly injured, but your neck pain was so great that you never said anything about your knee. You might not even realize that your knee was hurt, again, because of all the adrenaline. So now you go to an orthopedic doctor, and the orthopedic doctor gets an MRI and says, oh, you have internal damage and you need surgery. That very well may end up being a fight because you didn't say anything about the knee when you went to the hospital. The seventh red flag, the final one. What's the reputation of your treating doctor? Is your doctor known for specializing in treating patients with insurance claims and treating people who have been involved in traumatic events like auto accidents or slip and fall down cases? Does your doctor advertise for personal injury victims? If so, that might be a no-no. If so, the doctor's credibility will be suspect, as I said, a no-no, as will the validity of the claim. You have a primary care doctor, you love your doctor loves you, but your doctor may or may not be the right kind of doctor. There's nothing wrong with going to that doctor initially, so they might be able to make a referral to the appropriate type of physician, an orthopedic doctor, a neurologist, a physical therapy facility, even a chiropractor. All of these red flags about your medical records, be aware, be forewarned, be careful. To recap, are your medical bills proportional to your claimed injury? Where were you treated? Do your medical records suggest a lack of causation? Is there a correlation between the medical records and the treatment received? What's the quality of the medical information provided? What did you tell the first doctor you saw after the incident? What is the reputation of your treating doctor?